Okay, we're going to do lesson 8 and 9 in one video just because they're both quite short. So lesson 8, we're looking at what improvements have been made in diagnosis during the 20th and 21st centuries. So what you have to do is explain the significance of improvements made to diagnosis during the period 1900 to present. So when we think about diagnosis, we're thinking about how do we know what disease or illness we have when we go to the doctors, or do we do it ourselves? Do we, how do we know what's going on in our bodies when we're not feeling well? So first of all, what you have to do is write down the main ideas of Thomas Sydenham in this box here. So we're thinking about diagnosis in the Renaissance, because that's when we really start to see a bit of a shift in our focus here. Thomas Sydenham is an example of diagnosis changing. Because remember, in the Middle Ages, they just think it's God or the four humours, or, they have their set ways. Whereas in the Renaissance, we see some changes. So if we look at our picture here, you can use the images and figure out from those images, jot down some ideas of what was his kind of main ideas about diagnosing illness. What did he do? What did he say to do? Look at the images to help you if you just want to pause the video. Okay. After that, what you have to do is just have a look at the statements and tick the ones that you think are correct about the Renaissance. Did diagnosis take place between the patient and the doctor? Did they focus upon careful observations? Did Thomas Sydenham rely on books of Galen and Hippocrates? Did Thomas Sydenham encourage doctors to make careful descriptions of symptoms? And was technology used? So tick the ones that you think are correct about the Renaissance period. Okay, after that, we're looking at diagnosis. So you need to know specifically what forms of diagnosis happen now in the modern period. Now, you can think about it when you think about going to the GP, what happens? They ask you, what your symptoms like. They might ask you your family history because they want to understand about your genes. And they might say, is there diabetes in the family? They might, ask to a physical examination, have a look at where you're, saying, might be the ear. If you had an earache, might look at your throat. If you're saying you have back pain, muscle, they might ask you to bend, lie down on the bed and see how well your muscles are doing. They might request that you do a blood test. They might look at, looking at the ones over here, they might ask you to do a blood test. They might ask for you to have an x-ray if you think something's broken. An endoscope, they might want to put a camera inside your body to see what's going on. If you were diabetic, they might check your blood sugar. They might check your blood pressure. They might use ECGs to check your heart impulses, to check that that's correct. If you're having heart pain, just to track whether anything's abnormal. They might ask you to come in further for different scans. So we've got MRI, CT and ultrasounds, all for different things that you can read here to figure out what they are used for. Now, all of these improvements, you should be able to notice a very, very big theme. And when we think about our factors in medicine and the modern period, we see an extreme development in technology, and that's really able to help us in our diagnosis in the 1900s to the present time period. So what you have to do for this activity is read through each one, and you can highlight the benefits of each one. So if we were to go to blood test, it would say, so blood tests which have been taken since the 1930s are used to test for a huge number of conditions such as high cholesterol, which can lead to strokes or heart attacks. So I might highlight here that a huge number of conditions, high cholesterol, leads to stroke and heart attacks. That's why blood test is so important. I might then also make a note to say this is why they're important. And you have to do that for each one, highlighting the benefits and how it helped people. Once you finish that, I want you to compare what you've just figured out about the Renaissance period and the modern period in terms of diagnosis. And you're going to do this in the structure that you've been taught in a previous video, the same 4-marker question that we saw last time about comparing each something. So last time in the previous video, when we looked at this type of question, I said the first thing you have to do is you have to read the question and think, what is the focus and what are the time periods? So write a paragraph that explains one way in which, so it's about diagnosis, was different. It's about difference, not similar this time, in the 17th and 20th century. So that's what you should be doing when you see this type of question. You need to think, what are they asking you to do? What are they asking you to do, and what time period are they talking about? So they're talking about the Renaissance, the modern. They're asking you how is diagnosis different. Now you've just done that. You've just explained how they are different, and we've just identified a big difference. So using the same sort of technique we used last time, we're gonna write down in this section. If you don't have those lines, then obviously just do a star, write it here. We're going to write down, so it says here, there were notable differences in the diagnosis of illness during the 17th and 20th centuries. For example, during the Renaissance, doctors like blah, blah, blah. Give me some examples. However, by the 20th century, diagnosis changed. Now diagnosis consisted of, and then tell me how things have changed. So you might be able to identify, now diagnosis consists of improved technology, for example. And then you're going to tell me what and why, how that's changed. Now remember, for a question like this, I need to see that you're comparing, you're analysing a difference. So we're analysing this change of technology and we're using specific evidence to get 4 marks in a question like that. Once you finish that, you can then write down for me what diagnosis is, because that's really important that we have, and then copy out the summary on the board. Okay, thank you.